and how they've had to cut back on their services, and of course, in particular, why labor and delivery is often the first to go.
Yes, absolutely. Thank you so much for having me. This is an issue that, exists across the country now where we're seeing these maternity care deserts that are popping up, particularly with the COVID-19 pandemic. It has really stressed our healthcare system to the max, where now the public is really seeing what many of us in healthcare have known for decades, which is that there are fewer and fewer resources to go around. Oftentimes, maternity care services are the first to go, particularly in rural hospitals, because they're just not as profitable as some of the other specialty care services that are offered in these hospital settings, like, for example, surgery, particularly around orthopedic surgery or some of these interventional procedures that hospitals offer as well. So, with that, we really see a decline in access to prenatal care as well as a safe place to birth.
So, limited services, temporary closures of the entire unit, all of that,
Mhm.
just disheartening to hear. How exactly does that directly impact expecting mothers when it comes time to deliver? If they're in the hospital, are they going to receive services that are not up to par? What's happening there?
Yes, absolutely. I mean, I think the major thing is actually being able to have access to care. That means when you're in labor, when you arrive to the hospital, will there be a bed for you available? Or will those beds be filled with patients who have COVID-19? Or the nurses or the doctors who typically staff labor and delivery units, will they be pulled to other parts of the hospitals where patients are more critical? Right? To care for the sicker patients, the patients that might be dying. So we're talking about a reallocation of resources away from maternity care units in terms of staffing, in terms of funding. And where does that leave mothers? What should they do then? Often, in many cases, they're transferred to other larger hospitals that can accommodate the volume of mothers that have obstetricians and sufficient staffing to be able to care for these women. But in many cases, that may be, dozens, if not hundreds of miles away.
Are we also concerned about the health of the babies who are born in hospitals where there are staffing shortages?
Yes, absolutely. I mean, the hallmark of one of the major hallmarks of our healthcare system is that mothers in this country are able to deliver safely and able to have healthy babies. And part of that is being able to birth in a place that's safe, that's comfortable, not necessarily in an ambulance or a parking lot or any number of places where mothers may end up if they don't make it to the hospital. I would say this is even more of an issue as we talk about mothers who have high risk pregnancies or who have issues in their pregnancy where they need to be monitored and followed more closely.
So, what should you do if you are pregnant, you're concerned that the hospitals nearby you may not be able to serve you the way you should be served? Is there any advice you can give those women?
Yes, I mean, I think the number one thing is to plan ahead, to really think about in the event that my hospital has to close, where am I going to seek care? Speak about that with your doctor, with your care team, and also with your partner and family so that everybody is on board about what the plan is for you. I think the second thing is important to kind of recruit doulas and, of course, midwives who, in many cases, can attend to births in settings outside of the hospital. They're extremely instrumental in ensuring that women can deliver safely, and in many cases can be advocates for you. Can also provide prenatal education, postnatal education for individuals that need help in that manner. So those are some things that individuals can do as well. Also, I would just I just want to note also that birthing centers are another option. Birthing centers are different from hospitals, and that many low risk women who don't have any prenatal issues are able to also birth either at home safely or in a birthing center. But that's something they should definitely speak to their doctor about or their midwife about if they are considering birthing in an alternative location outside of the hospital. But that's also another option.
Wonderful. Doctor, thank you so much for sharing your time and expertise with us. Take care.